hospital. 2 of those are in ICU and they are both on ventilators. There were some 43,618 test results received overnight. I thank each and every one of those nearly 44,000 Victorians who went and got tested. Getting tested as soon as you register any symptoms is absolutely critical. It is not negotiable. You can't wait an hour, you can't wait an afternoon, you certainly can't wait 3 or 4 days. If you've got symptoms, there's so little cold and flu, the doctors tell us there's so little cold and flu in the community that you've got to assume that you've got COVID. Please come and get tested and we'll get your result back to you as quickly as possible. There's arguably nothing more important than people getting tested as soon as they register symptoms. That's how we shut this down. That's how we get not just running alongside these cases, that's how we get out in front of it, and it's how we get our community and our economy opened up again. There are some 82 exposure sites that are linked to this outbreak. I would commend to all Victorians to have a look at the website, just double check whether you might have been anywhere near those places at the relevant times, and if you were, please go and get tested and wait until you get your result. There'll be advice for you if you have been caught up in this outbreak as a result of the places you've been or the people that you've been in contact with. There are just on vaccines, I'm sure we'll come back to this in questions, there's 22,335 doses were administered yesterday. That takes to a total of 1.76 million and 610, so getting on to 1,761,000 doses that have been administered by state clinics since the vaccination program began in the state of Victoria. That is a very significant effort, and I think that sees us at the top of the table, if you like, in terms of state effort across all the country. Last night, I was very pleased to be informed by the Prime Minister, after requests that had been made both at National Cabinet and at an officer level before then, to receive and have it confirmed from the Prime Minister that we will receive just under 150,000 additional doses of Pfizer. They'll come to us very soon and we'll have more to say about where they will go, as well as some announcements in relation to the expansion into state clinics for younger Victorians, access to the AstraZeneca vaccine with all the appropriate consents, all the appropriate medical and other health information. We'll make those announcements quite soon. Today's not the day for that, but we will make those announcements quite soon. In essence, my message to the Victorian community is this is very, very significant to see this many cases, although they are all linked, but they are linked to 2 outbreaks and we don't know where those 2 outbreaks started. So there are mystery cases that sit behind this. The cases we've found since are linked to others that we knew, but they've been out in the community and there's every reason, in fact there is a certainty that there are more cases out there. That's why getting tested when you've got any symptoms at all is so important. It's why if you're asked to stay at home and isolate, please follow the instructions that are provided to you. And to the broader community, these rules are in place. As painful and as challenging as they are, these rules are in place to drive case numbers down. If we don't follow these rules, then we will, through our own choices, we will drive cases up. That's not what we want. That's not how we get through this and get open again. It's in fact how we, if we make bad choices, the wrong choices, it's how we all play a part in keeping the place closed. We don't want that. So please, I know everyone wants to visit loved ones and friends and family in their homes. You just can't do that. You just cannot do that. So many of these transmissions and others that we will find in the coming days will have been because people were visiting others and they ought not to have been doing that. They shouldn't have been doing that. Now, we can't change that. That's done. But what we can all do is make the best choices for our loved ones and for people we'll never meet. And that is as follows. Getting tested as soon as you register symptoms. Isolating, following the instructions that you're given if you're a close contact, if you are a case. And of course, in general terms, following the rules. This Delta variant spreads so fast. We look up in Sydney today, 5 people who have lost their lives. I think some of those are in their 60s. You know, we saw just this week a gentleman in his 20s. You know, this will go where the vaccine isn't. We don't have enough people vaccinated. We'll finish up with younger people in hospital, otherwise fit and healthy people. our system will be overrun if we don't bring this under control. That's why these rules are there. That's why we've all got a part to play. You know, I couldn't be more proud of Victoria, what we've been through and what we have overcome. We have it within us to continue to do this work, as tough and as hard and as gruelling as it is, and as much as we would love this to be over. None of us have the luxury of pretending that it is. When we get to 70%, we have more options. When we get to 80%, well, we have a very different way of life. But the only option available to us, as the Prime Minister and every Premier and Chief Minister in this country has agreed and signed up to again yesterday, the only option we have is these lockdowns to stop this Delta variant running wild throughout the community and having many thousands of people simply overrun our hospital system. The final point from me, if any Victorian is unconvinced by that and comes to a conclusion, oh, well, I'm fit and healthy, I won't get COVID. Well, it's not just COVID patients who will struggle to find a machine to breathe, or a nurse that isn't furloughed to care for them, or a hospital that's open to care for them. It'll be people who've suffered strokes, people who have had premature babies, people who have cancer and need urgent surgery, people who have heart attacks. All of that part of our health system would be compromised as well. That's why there's only one option, as painful and as difficult as it is. We've done it before, we will do it again, we will get through this, but everyone's got to play their part. I don't want to focus just on those who aren't. I want to congratulate and thank all of the many millions of Victorians who are, and I just ask that everyone just pause and think about the choices you're making and whether they are contributing to the spread of the virus or whether they're helping us to stop the spread of the virus. That's a pretty simple question to answer. It's also about whether those choices are good for your family and every family, or whether they are in fact making a difficult situation even worse. I'd ask everyone just to think about that and make those decisions, and make them in the interests of your own loved ones and everybody else across our state. I'll now ask Jerome to speak to the cases and the outbreaks in a little bit more detail, and then of course we're happy to take any and all questions you have.
Thank you, Premier, and good morning. So 29 new cases today. That's a total of 95 active cases in the community. This, of course, can include those in the previous outbreak. 30 of the active cases are associated with the Hobsons Bay cluster. 8 of the active cases are associated with the City of Marylebone cluster. We currently have a total of 5,520 primary close contacts, of which 3,500 are associated with the new outbreaks, and I'll go through those in a bit more detail. We cleared 433 primary close contacts yesterday. Again, my thanks to all those 433 people for continuing their isolation and being released yesterday. We continue, of course, to work off those remaining PCCs from the previous outbreak. We currently have 82 public exposure sites, but again, those exposure sites will continue to evolve over the coming days, particularly as we complete our contact tracing discussions with the new cases. In terms of the new cases we're reporting today, 4 of those cases are family members in the City of Marylebone cluster. So that cluster was at 4 yesterday, it is at 8 now. In terms of all the other cases, all the other 25 cases today are associated with the Hobsons Bay cluster. 1 of those is a family member of the original case. 4 of them are associated with the Spectacle Hub in Caroline Springs. That is 1 staff member, 1 customer and 2 further household members. That's a total of 5 in total for Hobsons Bay so far. We have 1 positive case associated with the Newport and West Footscray footy match, a teammate. We have 1 case associated with a Quran study at the Australian Islamic Centre in Newport. And we have 1 case, a staff member at the Wolf Cafe in Altona North. The remaining cases are all associated with staff members and students at Altaqua College. So we have 1 staff member at Altaqua College, 14 students at Altaqua College, and 2 household members of those students. That takes us to a total of 25 associated with Hobsons Bay, 29 new cases in total. We, of course, have continued our work on acquisition. The genomics for both these 2 strands, the Hobsons Bay strand and the Marylebone strand, are both confirmed as Delta strains. We have not yet found an identical match to any other existing clusters, either here in Victoria or elsewhere in Australia, but we are doing ongoing matching with other Australian outbreaks. It is what we can confirm is it's very closely associated with the New South Wales cluster and indeed with the City of Hume and the other clusters that we've been working on here in Victoria. So there is a very close commonality of the Delta strain and of those clusters, but more genomics work is being done. We do not yet have an absolute match. Two of the positive cases that we've identified today are old infections, and we may ultimately declare them as being no longer active. They relate to two family members of the City of Maribyrnong case who travelled, who spent some time in Sydney hotel quarantine and who returned to Victoria on the 15th of July. Now, this is only one of a number of possible leads. I don't wish to infer anything else around it, but it is a lead that we're continuing to explore. We will list the flight for that particular journey. So they left hotel quarantine on the 15th of July, travelled from Sydney to Melbourne on flight QF 445, which left at 12:40. We will be contacting other passengers on that flight over the course of today, seeking them to get both serology testing and PCR testing and seeing whether we can identify anything unusual about that flight. That work, of course, continues to be in progress. We've seen an exceptionally strong response from the community over the last 2 days around coming out and getting tested, with a significant number of primary close contacts. With over 43,000 test results today, 95.6% of those returned within 24 hours. I'm particularly pleased to see that for the wider community around Altacco College, all the primary close contacts there, 3/4 of them have now returned a negative test result. Similarly, at the Newport Footy Club, with 157 primary close contacts, 3/4 of them have returned a negative test result, and of course one positive that I referred to earlier. For the Spectacle Hub in Caroline Springs, again, we have 3/4 of the 78 primary close contacts returning a negative test result. And at the Wolf Cafe and Eatery in Altona North, where we have 18 primary close contacts, 72% of them have returned a negative result. Of course, one positive case there as well. And at the Epworth Hospital, Richmond, where we had a cleaner work who was positive, 2/3 of the 18 primary close contacts there have returned a negative result. And finally, at the warehouse in Derrimut, again, we've seen over half of the 31 primary close contacts have returned a negative result. Those really strong early testing results give us a really good understanding of where we're seeing the virus progress. It also underpins the high numbers we're seeing today because we've seen such a strong response from the community to get tested. Can I give a particular thanks to the school leadership at Altacco College and the entire school community for their active support. We've seen a very busy testing hub with 594 tests done just at the college yesterday and over 600 vaccinations at the vaccination hub there over the last 2 days. We will continue testing at the testing centre there will continue today till at least 8 p.m. Can I also stress that the pop-up vaccination hub is only for the school community? There's a lot of demand there this morning. It's obviously wonderful to see, and as we've said many times before, there is a huge demand for vaccination in Victoria. That pop-up hub is only for members of the school community. If you're not a member of the school community, you will be redirected to our other vaccination centres. Again, if you want to make an appointment, there are some, not many, Pfizer appointments available. For those who are eligible, there are, of course, AstraZeneca options. Please speak to your GP. We also, of course, are standing up our wider testing system. We have 8 lanes running at the showground site until 8 p.m. tonight. All of our testing sites will continue to run at higher capacity over the coming days. Yesterday, we saw around 1 hour on average waiting times across the network, slightly higher in the morning on the western suburbs. Again, I'd encourage anybody, regardless of where you are, whether it's the western suburbs or across Melbourne or across the state, please come and get tested as soon as you have symptoms or any connection to any of the exposure sites that continue to be listed. Our primary areas of activity today then, we're continuing to follow up the exposures at Warringah Park Special School. We also have a positive case associated with the Islamic College of Melbourne. We spoke to the school community there yesterday. We're continuing to speak to them today. The school there has already taken a lot of swift preemptive actions. They closed on Thursday. A lot of the school community have got tested already. We will continue to test that school community to see if we can establish any acquisition sources in that way. We're continuing to explore the work at the Wolf Cafe in Altona North and at the Spectacle Hub in Caroline Springs. And can I stress, with those exposure sites and potential transmission sites, as we say every single time, those venues have done nothing wrong. The virus does not discriminate in terms of where it goes. These are locations where people who have unknowingly carried the virus and transmitted it unknowingly to other people. We thank, of course, these venues in particular and all the exposure sites for their support, and we know what a challenging time it is. And can I commend particularly the school leadership, as we've seen over many months now, the strength of those school communities in responding is what makes us able to get hold of this so very quickly. Finally, of the positive cases we've identified today, 8 of them are located in a single-family household in a public housing residence. Those 8 positive cases relocated 2 days ago and last night. One group left 2 days ago, one group left last night. They are now in alternative and safe accommodation. We will be undertaking full testing of the rest of that housing building. That work is now underway. The residents have been informed this morning, and we'll continue that work over the coming days. And as we always do with complex apartment buildings, we'll provide full food and welfare support to the community to enable them to complete their isolation, to get tested and to do the right thing. Finally, from me, we have seen wastewater detects again crop up across the state, which highlights this is not just a metro issue. We've seen a positive detect in Benalla on between the 4th and 5th of August, a positive detect in Healesville between the 2nd and 5th of August, and a series of positive detects in the Upper Moonee Ponds area. Those, of course, continue to be investigated. And really, let me just finish by saying it highlights that coronavirus is not something which is located in a very tight geography. We now have a significant number of cases, 38 cases across 2 separate chains of transmission. We have ongoing investigations around source of acquisition. We have wastewater detects now in a number of different parts of our state, and we have over 3,500 primary close contacts associated with these new outbreaks. Those numbers will continue to rise rapidly. I thank everybody who is involved in being part, particularly for those primary close contacts. I know how complex and distressing that is. We will do all we can to support you and to get to the bottom of this as quickly as we can. I'll hand back to the Premier for questions.
Just a couple of further points from me. It's not all bad news. We have additional cases, but they're all linked. We've got a couple of mystery cases that drive each of those 2 separate chains of transmission. We just simply can't work out where they got it from. That means there's at least 2 other people out there, and potentially more than that, who have the virus and have given the virus to the people that we're dealing with now, but we can't identify them as yet. We may never be able to, but we're all working as hard as we can to find every single case. But that relies upon people coming forward and getting tested and doing so really fast, not waiting even an afternoon. You've got to go and get tested today if you've got symptoms, as you're listening and watching us now. Just before we go to questions, again, I'd be indebted to each of you, if in your bulletins and broadcasts and in other mediums, if you can, again, remind people that if you were a casual worker, for instance, who didn't have reserves to fall back on, or were in a position where if you got tested and isolated to wait for the result, you would miss a shift and therefore not get paid, no questions asked, $450 testing isolation payment. If you have to isolate for the 2 weeks, either as a close contact or a positive case, therefore you can't work, there is a payment of $1,500. We will push those payments out. We have done that for many thousands of people. It's very important that we support people to do the right thing and that no one has to make that choice between protecting the community and feeding their family. Those payments are very important, and I would commend them to anybody who's eligible. And we're not, it's a pretty easy process to receive those payments because the value of you staying at home far exceeds $450 or $1,500. It's in fact worth everything to everyone. It's how we get the place open up again. Questions?
Just on the genomics,
yes.
Is it the expectation of the experts conducting those tests that the genomics are not going to be able to be precise enough to determine if it's part of the New South Wales outbreak that we've been dealing with for a few weeks or a new incursion? Are we just not going to know anytime soon? Yeah,
look, I think you just have to wait and see. There's about 20% of cases where you can't get an exact match. It's definitely New South Wales, it's definitely Delta. The question is, to what does it actually link to? Now, it may well be that we can't get those links now, but as more cases further down that chain of transmission come forward, I know this doesn't make a lot of sense. If you can't get it up the chain, why would you get it down further? But sometimes you can. You can finish up with a much clearer match at a later point. That's why we'll continue to do it on as many cases as we can. And I think some tests are being rerun as well against the national database. Every sequence is in there. So as soon as we can add to what we've told you, we will. But you are right to say it may be that we can never get an exact match.
And the City of Maribyrnong case...
Which would not be the first time that's happened.
The City of Maribyrnong case and the returnees from New South Wales that they interacted with, those returnees have tested positive, but you're determining whether it's an old infection. Can you explain that?
Correct. And again, I won't go into any further details on that until we have the facts. I was asked the question the other day, are you looking, what are the lines of inquiry? That's one of them. We're not for a moment running a commentary on New South Wales hotel quarantine or anything like that, but it is of sufficient concern that Jerome's just given out the flight number, and we're going to be contacting each and every person that was on that flight, not just because they might be a risk to public health now, but if they've got historic from... They might fill in some of the blanks, if you like, as we look backwards, look upstream, which is very important as well.
And if 7 days is the intent, if running this to ground is the intention, as it always is, as Brett Sutton always says, to absolutely no local cases out in the community, 7 days looking likely?
Oh, it's too early for us to say. I'd much rather have no cases than 29 cases, but at the same time, this is an exercise in finding cases. So if they're there, we want to find them. We want to find them quickly. And our contact tracers are doing a great job, and so are those Victorians who are getting tested and coming forward and being part of this whole process. There are many thousands of people, 3,000 plus, who are at home now, many of whom will be for 14 days. And we're very grateful to them and we'll support them. But the other point, Nick, I've never walked away from one of these. We won't. We'll do all the questions. I just want to make this point as well. It is pleasing that we don't have another 7 mystery cases or even one extra mystery case. There are linkages. The question then becomes how many days out in the community have those cases spent? Who else have they infected? Are all of those infected people coming forward? That's why any symptoms at all, you've got to come forward and get tested. We'll get your result within 24 hours. We'll support you if you would be without income. If you're going to be out of pocket because you're doing the right thing by all of us, we will support you. Nick.
The Flemington Tower has been listed as an exposure site. I presume that's the public housing family Jerome was talking about.
Yes, and to that, Racecourse Road, and to that end, I'll just say, we've had, in recent times, we've had a number of apartment blocks where this has got in there, and we've managed those well. It hasn't been easy, but there's support being provided to those who have to isolate across a whole floor, and there's support being provided to those who have to isolate until they get a negative test. So that is Tier 1 and Tier 2. And those classifications, those designations can change based on the test results that you get. So that's working well, and we're very, very deeply engaged with community leaders and residents and those who are affected by this. But I just would point to the fact that we've had a number of apartment blocks that have been closed in one way or another, and we've worked through that, and we're very grateful to residents for being a partner in that.
And how difficult has that been, given the history at Flemington?
Well, I would say people know and understand that the steps that were taken and the steps that are being taken this time are all about saving lives and keeping people safe. I did a Zoom meeting with a number of multicultural leaders, many of whom also wear a different hat as a leader in that local public housing world in terms of individual towers or within public housing tenants. And the response was very positive. We're working very closely with them, very closely, and we will continue to do that in their interests and the interests of everybody's health.
Okay, your drone, talk us through the nuts and bolts of those historical Maribyrnong cases. Do the dates line up? What are you looking for? You're looking for undetected cases?
Part of the problem is that I think it's probably fair to say, Julia, that we would love dates to line up a lot more closely. We'd love genomic sequencing that took us to they talk about SNPs, so we would love a 100% match, not a 95% match or a 90% match. Sometimes you never get that clarity. It's not for the lack of trying. We run tests, we rerun tests, we ask them to go back into the national database. These two cases are mystery cases for a reason. We just don't know where they've got it from. We are getting a clearer and clearer picture of who they've given it to, and that's how you run an outbreak to ground. But there are cases out there that we don't know about, and that's why anybody out there with symptoms has got to come forward and get tested, and anyone who thinks they may have been at any of those 82 exposure sites in the relevant time period has to go to the website and look through that. And we're deeply grateful for the many, many hundreds of thousands of people who will in fact do that.
Are those the cases that visited one of the first cases in this cluster, the Maribyrnong man?
Yeah, there's a bit of visiting been going on across the board. I can't narrow it down to one. I wish it was only one. It's a bit more than that. And look, I would just make the point that there's a lot of other visiting, I think, going on also that isn't about a particular group or a particular postcode. The difference is that some of the other people across Melbourne and Victoria who are doing some visiting on the sly, thinking it's all innocent and fine, they've got lucky. They didn't spread it. Others have not been so fortunate. That's why the rules are there for everybody. But look, we're all human. We're all part of families. We'd all dearly love to see the people that we love the most. We would much prefer this was over and done with. I'd much prefer we were at 80 or 85 or 90% of the community having had the jab. And then I wouldn't be standing here talking about lockdowns. But we don't have any other option. I've been asked, is this a sustainable model? Well, this is the only model we have. That's not just my view. That's the view of the PM. It's the view of every Premier and Chief Minister in the country, because it's the view of every serious public health expert in the country. We can't let this run. We have run it to ground before. We will do it again. This is a very concerning day, and I would say that concern needs to be turned into and be expressed by people being motivated and acting on that, doing the right thing, following the rules and coming forward and getting tested. Even the most minor sniffle, come forward and get tested. We will look after you, and you may well be playing a massive part in us opening up again.
Premier, what about there's some communities, we don't want to target specific communities, but yes, obviously there seems to be maybe a miscommunication, or do you feel that the message, the health message, is getting through to the people who need to hear it?
Yeah, sure. It's a very important question, and it's one that we ask ourselves almost every single day. Is there more that we could do to get the message out to a bigger number of people? I would never rule out doing more. I would never rule out doing things differently. That's the only way to get through these things, is to be open to new ways of doing things. But I would say, in defence of an enormous number of people, many of whom are staff, many of whom are community leaders who do it, as a community leader and are not paid to do it, there is a massive effort that has gone on over these last 18 months. I think we are better today than we've ever been at engaging with communities the length and breadth of the state, in a culturally appropriate way, a faith appropriate way, a language appropriate way. It doesn't mean we can't be better still, but I don't see these cases as a result of any deficiency in the hard work of thousands of people. And I'm deeply grateful. There was more than 100 people on that Zoom meeting I referenced earlier on. I answered a number of questions, and I made a number of requests to those, principally Islamic community leaders, but others also. And they couldn't have signed up quicker to make phone calls, to reach out, to be a trusted voice. They've done it before. They're doing it right now as we speak, and I'm very, very grateful to them.
Ultimately,
if these two Sydney people came back on a flight on the 15th, that's a fair way back.
Yeah, it is. And no one's alleging that they've done anything wrong or that there's any deficiency in the way they exited quarantine. It's just part of a puzzle. It's a piece in a jigsaw puzzle. It may come to nothing, but we're sufficiently concerned that we need more testing, and no more or no less than that. It may be part of the puzzle. It may not be. As soon as we have more clarity, we'll be the first ones to tell you.
Are you concerned there could be unreported cases, unconfirmed cases lurking in the community if they were positive from the 15th?
Well, what I'd say to you is whenever you've got a mystery case, regardless of those two people and their history and the work we're doing to try and fill in some of the blanks with them, whenever you've got mystery cases, you've always got a concern. In fact, you know that there are other cases out there that have not been tested, that have not been detected, that are not locked down, whose close contacts are not locked down. That's why mystery cases are so challenging, even if you've got one or two of them. That's enough with Delta to cause really significant concern. And that's why, because you don't know where it is, That's why the whole state's locked down, and that's why we're locked down, because we simply don't know where this started. But it had to start somewhere, and that means there are at least a couple of other cases out there that we haven't yet got a public health response around.
Is that the primary line of inquiry?
No, there's multiple lines of inquiry.
Can you shed some light on some others?
No, I can't actually. Jerome might be able to, but in essence there'll be, again, still even days later, we're still interviewing people, we're still tracking their movements, we're still going back and forth. Where were you? Who were you with? All of those things. That can sometimes take some time. There's multiple lines of inquiry, and as more people get tested, as more people have their swabs run through the genomic database, we may get a clearer picture. We certainly hope so, because that'll give us greater certainty when it comes time to make some very difficult decisions in the future. But yeah, look, we have a chance that other jurisdictions in this country simply don't have. We have a chance to drive these numbers down, but it's not. I can't do this on my own. We can't do this alone. It is up to every single Victorian to play their part, and I thank those who are, and I just say to those who might not be, you know, we are all in this together, whether you like it or not. We're all locked down together, and we'll all open up together if we all play our part.
Do you think it's possible that we might find a link between Maribyrnong and Hobson's Bay somewhere in the middle there?
Yeah, yes. And
if Jerome's got more to add on that, can we hear some
if he does, he can. I'd love nothing better than 2 chains of transmission to turn out to be 1. 2 mysteries turn out to be 1 mystery. That would be fantastic. And then if we can solve that, no mystery cases is always better than having any. And we've got to have a very low tolerance for even 1, given how fast this thing spreads. Jerome absolutely can add to this, I'm sure.
Thanks, Premier. So, in terms of the ongoing investigation with the 38 cases across the 2 clusters, we're working both upstream and downstream. So, if I look at the 4 new cases today in the Maribyrnong cluster, we think there is potential that they're upstream from the 4 cases we already knew about. So, it is possible that they are early infective periods, that the acquisition came through that route. That is a possibility. That's one of the reasons why we've listed and we're looking at this flight pad to see whether that is part of that particular jigsaw. Similarly, for the Hobson's Bay cluster, some of the cases we identified yesterday, so that were in yesterday's number, look like they have an earlier acquisition period than the original 2 cases or the first 2 cases that we reported. So that is a possible, I stress, possible source of transmission in. With the number of cases we're now seeing, one of the key bits of work for our contact tracing team is to try to establish what those infectious periods was and what those chains were and what the causality flows were. That work is still, that picture is still building. It'll continue to build over the next few days. Obviously, the key thing for us at the moment is to get the dragnet out there and to get as many cases that are out there identified, locked down, isolated, and to work out what those links are between them.
Given those cases, the infectious periods, it looks like we're going back further and further.
Yep.
I want to ask if this has been investigated. The last time when we had this conversation in the last outbreak, about 2/3 of all close contacts, a third, weren't getting tested when they were in isolation until day 13 or 14. Based on the average positivity rate of close contacts, epidemiologists have done estimates on this. There were likely more than 10, potentially 20 cases that we didn't pick up in their isolation period because they weren't getting tested until day 13, at which point they might have been negative because, as we know, they're infectious before they go into isolation. Are you going back and checking whether those close contacts who did not get tested at the time were in the areas where the virus is now circulating? Is that an investigation, whether there were cases we didn't know about because they weren't testing, spawning new chains of transmission?
Yeah, so I think you're halfway, on the mark and halfway sort of off in the wilderness a bit. So the pieces here is that every single primary close contact goes into isolation, has to complete their 14 days of isolation. If they clear a negative test at the outset of their isolation, the people, the 75% of people in some of these communities I've talked about, they continue to be in isolation until their day 13 test. They have to clear a negative day 13 test before they go through a whole clearance process. And we talked about this, 10 days ago with the previous outbreak. So absolutely, I've always preferred people to get tested early on, but even the small number that don't, the small proportion that don't, they will be tested at day 13. They can't exit quarantine until they pass a negative test at day 13. So there's no chance of them being out in the community, spreading it, because they're under control, they're in isolation. So I don't have a concern around the fact. What we are looking at, absolutely, Paul, is what are all, with the previous outbreaks, all the known cases, we're looking at all those exposure sites again. We look again at the new cases we're seeing and saying, are there overlaps in exposure sites? We're going back to some of our old cases and saying, can we check again? So if I talk to the traffic controller we talked about the other day. We're talking to the traffic controller and saying, we're hearing about another potential link here. Is there anything else you want to tell us? So all those things are being re-prosecuted where we think it's, where we've got the evidence, the indications. I think it's worthwhile.
I think there's two things I just want to go back on that on. So the first point is many of the close contacts were infectious in the community before they entered isolation. So it doesn't necessarily matter that they were in isolation for 2 weeks. They were at exposure sites before their isolation period. And the second point is, if they were tier 2 contacts, when the primary close contact gets a negative test on day 14, the household contacts don't need to get tested also on day 13.
That's right.
So they may have been positive as well and have left isolation and spawned new exposures.
No, I just don't see that last thing at all. Look, Paul, you're absolutely right. So we're always contact tracing on our primary close contacts. We're always concerned about where they may have been, what they may have been doing, and following those leads through. And I think if you look at the experience and the way we've got through these outbreaks in the last 9 months or so, you can see that work's been done. That's why we have these multiple rings of contact tracing. That's why we lock as many people down as we do. That's why we had 25,000 primary close contacts in the last outbreak. That's why we've got 3,500 now already, and that number will go up massively. So we're confident, and we are looking at those. What else they did beforehand. In terms of secondary close contacts being released, secondary close contacts are locked down until their PCC clears a negative test. We're very clear on that, and there's no obvious release I can see there. There is always a risk in anything we do, and it goes back to Premier's comments around how we all behave. There's a huge onus on all of us as Victorians to do the right thing, which is get tested when you've got symptoms. And even if you didn't get tested when you first had symptoms and you're sitting at home and saying, oh, I'm going to be in trouble if I turn up for testing now because it was 3 days ago, get tested anyway. It is so much more important. I'll come back in a minute, Nick. The other thing that's important is when we're asking people to isolate and we're telling you to isolate, you have to isolate. That is the single most important thing to do, and that is the single most important thing we have to secure.
Why don't we mandate testing when people go into isolation?
Sorry?
Why don't we mandate testing when people go into isolation?
Because again, there is no additional public health value in doing it. When you're sitting here, we're in the second day of this outbreak. We've got over 3/4 of people who are associated with the most significant exposure sites already having returned a negative test, which means they got tested more than 24 hours ago. That is a significant, people know what we need to do here in Victoria. We don't need to create yet more internal hurdles and more internal barriers and more choke points to get the impact we're trying to have. They're in isolation. That's the most important thing. Nick?
Back on Flemington Tower.
Yeah.
Is it all the people on the same level at Tier 1 and the rest of the tower is Tier 2?
That's right.
So can you tell us how many people are involved and whether you're going to be setting up a special testing hub in that area? So
I was briefly at Flemington this morning, just before I joined the Premier here. So what we have an existing and well-established community testing and public health team that are based at Flemington. They've been based at Flemington for many months. They're working very closely with the community. During the course of today, we will be in-reach testing for the people, the neighbouring residents who live on the same floor as the positive cases who have left the building. The positive cases left the building over the last 2 days in 2 separate tranches. All other residents of the building, we will also provide additional testing capacity for. There's a dedicated testing centre being set up on site as we speak. Other residents of the building on the other floors will progressively be asked to go into that testing centre to get tested over the course of today and the course of tomorrow. And there's a whole community-led, council-led, supported by us, welfare and support team in place to ensure that everybody's got what they need in terms of food supplies and all the other support we provide, as we have done now for the last 3 or 4 months on every significant apartment building.
And do we have any idea of the numbers?
My understanding at the moment is, Nick, and we're still working through the details of the numbers, we have around 400 people in total in the tower that we're working to who are both Tier 1 and Tier 2. I don't have the breakdown in my head, but it's only one floor that is Tier 1.
John, what is your main concern? I mean, obviously the whole situation is of a concern, but what really has got you nervous at the moment, or what are you really sort of focusing on, or what's got you worried?
Oh, look, I think, as I said, look, we're seeing a very significant number of cases coming through and a number of significant transmission sites that are now active. The thing that's of most, the biggest priority for us is to establish how many more cases we may have had upstream, so that we can establish all those different chains of transmission. That's why we're putting a lot of work into a number of these lines of investigation, but that's why we're also saying to the entire community, come and get tested. We've got, as I said, over 3,500 people who are being actively contacted and encouraged and directed to isolate and to get tested. But please do not, if you've got symptoms, if you're at all concerned that you may have been involved in this in one way or another, just come and get tested. There is no negative consequence from doing that.
Ryan, entered our last lockdown,
Yep.
lockdown 5,
Yep.
at a time when we'd only had one donut day, effectively.
That's right.
Now that we have these cases that are a concern, potentially linked to these current cases, really going back pretty much until, like, during the time of that last lockdown, do you think that we exited that lockdown too early now that we're in another one?
No, there's no evidence to point to that at this point, Julie. If we look at the trajectory of the last lockdown, we had, and my memory's a little bit faulty this time, I'm sure, but I think we had something like 14 days of no cases in the community. Over 14 days of no cases in the community. We didn't lift out of lockdown until we'd completed 8 or 9 days of no cases in the community. We had 7, 8, 9 days before we saw this first case crop up. So at this point in time, we don't see any obvious associations. That doesn't mean to say there aren't any linkages, but the linkages will be further back, and there will be ones that we hadn't at that point identified. So that's the work we're trying to do at this point in time. And I think it would have been very difficult for us to sit there. Bear in mind, we have this focus on getting control quickly, activating these short, sharp lockdowns at the very earliest sign of this Delta strain being out there. I think it's a test of the community support to wait for that long and to sit there on 0 cases and say, well, we're just being precautious.
Let me add to that, perhaps. Look, we haven't got links. There may be. We'll just have to see how that unfolds in coming days. But I wouldn't have fancied standing here for more than a week with each and every day no cases that had been in the community, keeping a lockdown on for another 7 or 8 or whatever it would have been, 9 days, whatever that, you can do the maths, but it was certainly a week or more, and we had well and truly a week or more where there were no cases in the community. I would just make the point for those listening at home, those watching at home, 0 is always the aim, but it's not 0 cases, it's 0 cases that were out and about potentially infecting others. So a donut day, always terrific, but it's not necessarily, you can have 4 or 5 or even 20 cases. But if they were all tucked away from other people, isolating, no risk to public health, then they can't have given it to anybody else, and that's as good as a 0 day. We're some way off that, given the number of cases that we've got at the moment, but we're all working as hard as we can to drive it back down and drive it into ISO, if you like. So once we're locked down, because movement means infection, we've locked down quickly, we're finding these cases quickly. The mysteries are a concern to us, but we're all working as hard as we can to try and solve that puzzle and find where these cases have come from.
What about the western suburbs? Are you going to direct extra vaccines in that area? We've got a boost now, so...
We do, yeah. So we'll have some further announcements to make, and you would appreciate, I think, in relation to AstraZeneca, confidence is very important, and having a medically-led model, medical or pharmacy-led model is very important. We will have more to say quite soon about many more Victorians being able to access AZ in our state clinics. We're not quite ready to do that, but we will be very soon. In terms of the additional just under, I can't remember the exact number, but it's as good as 150,000 doses that the Prime Minister confirmed to me last night we'll be getting quite soon. And again, we'll have announcements to make about where those extra doses will go and whether there's any change to the way the vaccine will be rolled out because we've got that supply. I do stress we're very grateful to have that additional 150,000 right now, but it's not 150,000 we were never getting. It is a bring forward. It'll all even out over time, but now's the time to get vaccinated, and we'll have more to say about how you can do that.
When would you like to see under 40s being offered Pfizer?
Well, as soon as we have sufficient supplies. And this goes back to the point I've made many, many times, and the point I hope that, and I genuinely think from talking to people understand that the limiting factor, the inhibiting factor, is not we haven't got enough nurses, or we haven't got enough clinics, or we haven't got enough this or that. We haven't got enough vaccine. That's what's driving the fact that this is being rationed, and we can all have views on that. What I would say, every death is a tragedy, every death is terrible, but we're not seeing this run wild through private sector aged care in Sydney as it did here in Melbourne, principally because those people in those age groups have been through the vaccination program. So starting with those who are at the highest risk was the right call, and I know it's always hard to measure things that don't happen, but I'm very pleased to see that even though they've got a terrible situation in Sydney, it's not having the same tragic outcome that, of course, the virus had here last year.
Wastewater detection in Wangaratta was one of the reasons you said the regions were being included in the lockdown.
Yes.
It turns out to be a false negative. Can you understand that people in the regions feel a bit dudded?
Well, what I'd say to everyone in regional Victoria, whether it's in Wangaratta where I grew up or any other part of regional Victoria, there are mystery cases. We don't know where this is. We've got wastewater in Benalla and Healesville, separate to the Wang issue. And look, we apologise. We try and get the best information out as quickly as we can. Nothing's perfect. No one's ever pretended that it is. It is not the only, wastewater is not the only reason why people are locked down across the state. The real number one reason, if you want to put it in those terms, the most important reason, we have mystery cases, at least 2. We don't know where they've come from. We don't know who they've given it to. And on that basis, everyone is at risk. This got to Mildura last time. It's got to Armidale. It's a long way out of Sydney. So, we take a cautious approach. No regional community wants this. And we certainly don't want a situation where we've got to fight on multiple fronts because it gets away from us in regional Victoria.
Is it safe to assume that regional areas are going to be included in all? Is it safe to assume that regional areas are going to be included in the lockdowns from now until the end of the year, given we have this more infectious Delta variant?
No, the best way to, I think, to project forward is those parts of the state will be included. Based on the advice I'm given, that is what will be included in the lockdown. That is the terms and conditions and provisions of the lockdown. It's not a political judgment. It's not one that's made by me. It's made by public health experts who look at the epidemiology, the history of every single case, what we know, what we don't know, what we suspect, and they make judgments. And what the National Cabinet has agreed and reconfirmed in the strongest possible terms yesterday is that there's only one option. There's only one weapon we have against this, and that is the quick, hopefully short, sharp lockdown. And I'll always take advice on whether that should be part of Melbourne, all of the state. I wouldn't draw any further conclusions than that. If I get the advice, we follow the advice. It's served us well, and there's really no alternative.
Premier, I've got a colleague who's asked whether you regret saying that we crushed Delta.
Well, I just say to your colleague, if you're asking me, is it wrong to congratulate Victorians for the amazing job they've done over these 18 months? I don't believe it is. This is, we believe, a separate outbreak, a separate issue. We will deal with it, and I'm confident that we will get on top of this again, because Victorians know what has to be done. They know that there's no alternative. If we had another lever to pull, another weapon to use, another strategy to pursue, of course we would. And if you're unconvinced by me saying that to you, the Prime Minister, every Premier, every Chief Minister and every public health expert that advises us as a National Cabinet has made it abundantly clear, crystal clear, until we get to 70 and 80% vaccination, the only option we have is the one we're using now, and that is to limit movement so we can find cases, isolate them, drive the numbers down, and then open up again. Is it perfect? Is it where you'd like to be? Of course not. I'd love everyone to have been vaccinated. They aren't. We're working as hard as we can to change that, and as soon as we get supply, we'll get it into people's arms, and that's when the world will change. That's when there'll be a very different set of rules, and we'll be much closer to what we would all regard as normal.
A lot of people were saying this like when they saw the numbers this morning. A lot of people are pretty angry. It seems some people are following the rules and some people aren't. How can we take people along with us if it seems that there is a portion of the community that are not listening?
Well, I just make this point. Getting angry doesn't work against this virus. If it did, we would have ended a long time ago. I think, of course we're angry, of course we're disappointed, of course we would much rather be in a different set of circumstances. No one wants to be in lockdown, no one wants a global pandemic. What we have to do, though, is we have to look out for each other, and we have to channel that sense of frustration and the sense of fatigue into making the best choices. Each person, each family. If we all make good choices, we will limit the spread of this. The alternative, no one gets a leave pass from this. It doesn't care who you are. or where you're from, or who you pray to, or how much you earn, or who you're visiting. If you've got it, you will give it. You will take it somewhere else, and you will put all of us at risk. That's why the rules apply to everybody. The rules don't discriminate because this virus doesn't. And we shouldn't discriminate against any particular group. I just appeal to people, none of us can change what's occurred, what's happened yesterday or last week, but we can all make the best possible choices for each other going forward, and that's what we have to do.
Have you given any more thought to prior?
Those people you were alluding to
Yes.
earlier who'd been visiting.
Yep.
I understand at the moment you need to get as much information out of them as possible, but will they ultimately be fined or punished for breaking the rules?
Well, look, what I'd say is this: there's a fine balance to be struck, and I know that there is sort of people rush to, and I don't blame them. Righto, books should be thrown at these people. Righto, let's just think that through for a moment. If we start sending a message that if you've got this virus, you've done something wrong, and that's what it will be read down to. There's already some stigma in different parts of the community, and we have to deal with that. We shouldn't be adding to it. What we'll do if we punish everybody who comes forward, it'll just drive the thing underground. People will not get tested. People will not isolate. People will pretend they haven't got it for fear that they'll be punished or there'll be some sense of shame or stigma. Now, that will produce one outcome and one outcome only. Not hundreds of cases, thousands of cases. We don't want that. We want people to come forward. We want people to do the right thing. We want people to get tested and then follow the instructions they're given. We want everyone to act in a way that doesn't add to the spread of this, but instead helps us all as a community contain it and drive it down. I think everybody, regardless of their background, knows and understands this far into this what good decisions are and what bad decisions are, what good choices are and what bad choices are. I just appeal to people to think about the people they love the most and then just picture them. And as someone who's spent a bit of time in ICU this year, great staff, not a great place to be. No one wants to be in intensive care. Think about the people you love the most and then picture them on a machine to breathe. And when you're thinking about going and visiting a mate or doing the wrong thing, just think of that picture. Now, we can punish our way out of this, but gee, it'll take a long time and it just won't work. What's most important is to work with people and get people to make the best choices and tell us the full story. The full story is worth so much more than any fine we might levy, as good as that might make us feel for a bit. I'm not criticising that. And there is a sense of, as I think Candice indicated, a sense of anger. But anger doesn't work. Only working together and being determined against this virus works.
Have you given any further thought to prioritising teacher vaccinations now that we have more school outbreaks?
Well, we'll have more to say about where those extra doses will go, and I'm not inviting you to assume that they're going to go to teachers. It's only 150,000. It's better than not having it, but it's not 1.5 million. You know, we've got limited supply. I made the point the other day, and I'm not critical of any group who mounts the case that they should be higher up the queue than they are now. There's literally hundreds, thousands of groups that can mount a really compelling argument. The problem is that we don't have the stock. We just don't have the supply. So the fact of it is, Julie, there are lots of people we've had to say, despite their very good arguments, we've had to say no because we just don't have the supply.
But given the evidence of school outbreaks, it's clearly a vulnerable setting. Will some of those brought forward allocation be going to teachers?
And I wish it were the only vulnerable setting. There are many vulnerable settings. That's part of our challenge. And there's not sufficient supply for everybody in a vulnerable setting to get one dose, let alone two.
Is there sufficient supply for teachers with the bringing forward of the allocation?
Not at 150,000, there isn't, no. But again, I don't want to, by ruling in and out every different group today, to make announcements that I'm really not ready to make, but I will make them. We only got confirmation last night in a text between the PM and myself at about, I think, 8:30, 9 o'clock last night, that we'd be getting the 150. If we haven't got them yet, we're getting them quite soon. And there'll be a lot of work done this weekend and into early next week to decide where they go. And as soon as we've made those decisions, we'll let you know.
The New South Wales Premier is now talking about zero community cases as an aspiration rather than a target, whereas 2 weeks ago she was saying it was a target. Given this outbreak here is now seeped into a demographic where there's a greater proportion of essential workers, communication barriers, larger families.
Geography where there's a greater proportion of essential workers as well.
Larger family groups and the growing risk across the border.
Yes.
Is zero community cases becoming less attainable and less realistic as time goes on? Are you factoring into your decision making that maybe vaccinations are actually probably going to be our only way out of this, and we might be stuck in a situation with community cases for a really long time? Is it attainable?
I think it still is in our state. Whether it's still attainable elsewhere, I'll leave other leaders in those jurisdictions and chief health officers in those jurisdictions to answer that question. I would just say, and again, I can't go into word for word what was discussed at National Cabinet yesterday, but what I can confirm, if the Prime Minister hasn't already, I'm sure he probably has, but let me reconfirm for you, every Premier, every Chief Minister, including the Prime Minister, signed up again yesterday to, literally 24 hours ago, to an aggressive suppression strategy that is a recognition that it's not perfect, no one's enjoying it, but it's the only tool we have until we get 70 and 80% of the community through the vaccination program. There's no other option. Or sorry, there is one other option. You give up. You white flag the thing. And then we sit back and watch our hospital system simply overrun, as is happening in other parts of the world, as is not a matter of scaring people or shock tactics. It's just true. It's happening. This thing spreads so fast. And I see some commentary from people, who are not medical experts at all, talking about whether this is more deadly or less deadly. It's not a function of its deadliness. It's a function of its infectivity. So many more people will get it, and they will finish up in hospital, and a tragic percentage of those will finish up dying. If it was any other way, well, then we would employ different measures. Of course we would. If there was an easier way, if there was a less painful way, then of course we would avail ourselves of those options. But until we get that vast majority of Victorians and Australians vaccinated, not with one dose but with two, this is the reality that we have to live with. And it's not pleasant. No one is happy about it, but you can't deny it. As unhappy as you might be, you can't wish the thing away. That's why everyone making good choices, everyone doing the right thing by their family and every family. And I just take you back to that image. Think about the person you love the most in the world, and then think about them gasping for breath with a machine to help them breathe. Think about that, and then think about the choices you make.
Given vaccines are our way out, you talked before about AstraZeneca and the hesitancy that exists. We all know it exists. Have you thought about using your extremely powerful voice in this state to be really, really clear and constant in your messaging that AstraZeneca is safe and anyone who wants a vaccine should go and get it? Yeah,
well, I'm about to expand the AstraZeneca program, and there'll be many, many people who'll be able to get AstraZeneca in state clinics who can't now. We'll share those details with you very soon. When I say I don't see a hesitancy, I see that there are some who are eligible, there are some who aren't, and I think there are millions of Victorians who want to get vaccinated like tomorrow. We just have to have the supply for them. I've always said, always, that rather than me giving you a sense of whether AZ is good, bad or indifferent, go and talk to your doctor. Go and talk to your doctor. And for the vast majority of people, the advice will be AstraZeneca's safe. Go and get it.
But that's a barrier in itself. Going to see a doctor is something people don't want to have to do. But it's a 1 in a million risk.
Yeah, but hang on.
Why don't you say that?
Well, we've got a target there for a reason. We've got all manner of different processes, and I think it would be unwise to dispense with the confidence or disregard the confidence that comes from a rigorous process. That too brings confidence. Now, we'll have more to say very soon about AstraZeneca. We have a stockpile. We have a likelihood of getting even more of that. And I think, far from hesitancy, I think that there are many, many people who know and understand that the risks with input from their doctor or a pharmacist, the risks are very low, and the risks posed by AstraZeneca are much lower than, for instance, the risks of getting COVID without having had the jab. But I think I've been a pretty good spruiker for it, but I'm not going to provide de facto medical advice to people. I just don't think that would be a very good idea.
That there won't be enough Pfizer.
Go one at a time. Sorry, yes.
We're hearing at our TAC right now.
Yes.
The community is the words I'm getting from out in the field is there's almost a revolt because people are going there who are not specifically a primary close contact or been from the school, but they want the vaccination.
Yeah, sure. There's many people who want to get vaccinated. Many millions of Victorians would, I think, queue up right now if the vaccine was available. It isn't, and we'll have more to say about changing that a bit. Well, it's not going to be, we don't have 3 or 4 million doses. We've got 150,000 extra Pfizer, and we have some supplies of AstraZeneca, and we'll have more to say about it. We are already leading the country, I believe, at sort of 1.7, 1.8 million shots. We aim to continue to do that. That's in state clinics, and there's obviously many more than that being delivered via GPs right across the country. So just to finish that point, there's nothing wrong with the debate, there's nothing wrong with people having a different view, but from my point of view, the sense I get, I'm not seeing widespread resistance to getting the jab. I think there are many millions of people who want to get vaccinated as soon as possible. We just don't have the supply. As soon as we do, I'd expect that they will queue up. They will be there to play their part and to be part of a very different future where there will be greater freedom if you have been through the vaccination program.
Are you concerned there's going to come, just on vaccines, are you concerned there's going to come a time where there's not enough Pfizer for young people, for people in very young age groups, and AstraZeneca is going to be the only option?
No, well, I would point you to COVID Shield, which is I didn't come up with that name, that's the Commonwealth Government's name for the vaccine rollout program. General Fruin has released that recently. There's Novavax, Moderna, there's other vaccines becoming available to us at the back end of the year. Now there's a mix, and they're probably the best ones to speak to that.
Do you think businesses should have powers to insist that their employees are vaccinated?
Well, there are certain rights and certain obligations under employment law. Employment law, is particularly for Victorian workers, is largely a feature of the Commonwealth. Those powers were referred back during the 1990s. We've already got a situation where some workers will be mandated, aged care for instance, high-risk settings. I think you're best to encourage people in the first instance, and again, it is a bit hard to have, in good faith, it is a bit hard to have the mandatory conversation with people when you've got literally a queue of people who want to get vaccinated and not enough stuff to vaccinate them. This would be a much easier discussion if the only barrier was the wrong choice that some people will make. We'll just have to wait and see. I think that becomes a much more relevant discussion a bit later on in the year.
Can I just ask Ryan a couple
Absolutely.
of quick questions?
Absolutely. Any more for me?
Yes, just on tasers.
Yes.
Are you going to roll them out to police officers across the board anytime soon?
Look, we send our best wishes to the officer that's been injured and to his family. I understand there's a history of police service in that family, and we thank that officer and his family for their service, and we thank each and every member of Victoria Police for the fact that they put themselves in harm's way to protect us every single day. One of the ways that you honour the service of our policemen and women is to give the Chief Commissioner everything he asks for. We are working with the Chief Commissioner on these issues, as we have done in the past. We've recruited more police and provided the best technology, the best equipment, but there's always more that we have to do, and that's why we work so closely with Chief Commissioner Patton. And again, I send my best wishes to that officer who is in hospital. We wish him well, and we send our best wishes to his family. There is a history of great service in that family, and we honour and thank them for the contribution they've made in keeping all of us safe.
Just a few more on COVID. If we continue to see cases centred in Melbourne, would you consider a ring of steel around metropolitan Melbourne?
We don't rule anything out. It'll be a matter of advice.
And on our situation...
I do have another border I've got to protect against at the moment, which is the New South Wales border, so it's a bit challenging at the moment.
Regional mayors were calling for that.
Sorry?
Regional mayors were calling for a ring of steel around Melbourne.
Well, regional mayors are entitled to their views, and we'll work as best we possibly can to protect every single Victorian. But I have no advice to do that at the moment. I have no advice to have different settings in Melbourne and regional Victoria. In fact, my advice, the very clear advice to me and to my colleagues, and therefore we have no alternative but to follow it, is that the settings should apply to the whole state. And the Benalla and Healesville wastewater detections today are just another example. What's more, the fact that we're dealing with mystery cases. We don't know where they are. We don't know where they are, and we don't know where they've been, and we don't know who they may well have infected. I just remind everyone, this made its way to Mildura. You can't get further from Melbourne than that. This made its way to Mildura last time. Who's to say it won't make its way into regional Victoria again? And if it does, the only way to limit infections is to limit movement, and that's what lockdowns do. Painful as it is, it works.
How are the vaccinations going at Altacul College?
There's several hundred that have been done. I was my last update. I'm not sure where they're at now, but you know, where we have supply and where we believe that it protects public health across the board, then we always reserve the right to roll out programs. Obviously, we want as many people vaccinated as possible.
Will we see more pilot programs?
I'm not sure. I would hope we don't see more outbreaks at schools. That would be my hope. That's what we're working towards.
Just on the New South Wales border,
Yes.
obviously the permit restrictions are in place, etc. But this is now our second incursion from New South Wales, our second lockdown as a result of what's happening in New South Wales.
Yes.
You would have seen the New South Wales figures before you came out today, their worst day of the entire pandemic. Can Victorians expect to go in and out of lockdowns until New South Wales gets on top of its situation, do you think, just by virtue of our geography?
Yeah, sure. Look, the only comment I want to make about New South Wales today is to send our best wishes to them. This is a very difficult set of circumstances that they confront. To the families of those who've lost a loved one, the families of those who have passed away, I should say, we send our very best wishes. And to all of our colleagues in New South Wales who are working very hard, I know they're working hard. You know, I text back and forth with Gladys a bit. We're not talking every day or anything because we're all busy, but you know, it's tough. We've been there. We know how hard it is, and that's why we're working so hard now, popular or otherwise, to try and avoid that sort of situation where the only way forward is to vaccinate everybody, in the full knowledge that vaccination is months away. We have a chance to avoid that. In fact, I'm confident if we all work together, we will avoid that. But yeah. That's the only comment I'll make on New South Wales. We've made the difficult decision to determine that Sydney is extreme risk. We haven't done that lightly, and I think that probably tells you all you need to know about how serious a challenge it is for us. And having grown up not far from that border, I know how difficult a bubble is. I know how difficult permits are. I know how difficult this must be for those communities. But what's more difficult than that is having COVID-19 in those communities.
But are you frustrated with the decisions that the New South Wales government made to wait and see early on with this outbreak, given that it's now impacting the freedom of Victorians?
Well, I suppose I'll take you back to my earlier answer. Frustration doesn't work against this virus. So whether I am or I'm not, and you can make your judgments about how likely or unlikely I might be to be frustrated. Look, there's a lot of things that are frustrating in this, but none of us have a luxury of pretending it's not real, and none of us have the luxury of waiting. You've got to act quickly, and that's what we have done. But again, no government can do this on its own. As good as Jerome and his team are, many thousands of them, they need Victorians to work with them. I need Victorians to work with me and our team. And if we do that, and we all make the best possible choices, as hard as they might be, we will drive these numbers down. That's our only way forward until we get 70 and then 80% of the community through the vaccine program.
Just on our cases today, I think they're the highest daily case numbers since September. How concerned are you that we could be facing a similar to the second wave, and what have we learnt in that time, and how are we different?
Well, we learn from every outbreak, we learn from every case, and we will continue doing that for as long as this runs. It's not over. These are not numbers that we like to see, but pleasingly, they are all linked. The problem is that these two chains of transmission begin from cases that we can't work out where they got it from. They are mystery cases. But we're all working as hard as we can to try and solve that puzzle and have them not mystery cases. But if we want to, the next few days, and indeed the rest of this year until we get people vaccinated, will all be about, and the thing that will make the biggest difference is if we all follow the rules, and if we all play our part. Get tested when you have symptoms, as soon as you have symptoms. If you're asked to isolate, please do as you are asked, and that's how we'll drive these numbers down.
Jerome, just a question on...
Absolutely, Jerome, go for it.
The hotel quarantine, the Sydney people that were released from hotel quarantine, obviously there's a lot of questions around that. Do they have an exit test up there before they're released?
So look, we've certainly spoken to our colleagues in New South Wales. The two individuals that came out of hotel quarantine, let me add again, they've done nothing wrong. and this is one of a number of leads of the investigation. They tested negative throughout their stay in New South Wales Hotel Quarantine. They departed on schedule on the 15th of July, went straight to the airport, jumped on the plane and came here. What we know is that they've given us a positive detect. We're doing some serology work with them to try and establish what more we can, and of course all those investigations continue.
So that might be historic. It's obviously it's not a. They don't have a high viral load at the moment.
No, that's right. It's a very low viral load. So we know it's an older case, and of course that's all part of the jigsaw that we're building at the moment.
If those cases fall in the Maribyrnong cluster,
Yeah.
wouldn't the genomics link back to cases from quarantine hotel rather than the broader Sydney outbreak?
Well, that of course depends. Again, we're now in the world of speculation and what ifs. But there's a number of different potential scenarios. So if it's a case out of hotel quarantine, there should be a match with existing cases in the New South Wales system. If there's an infectivity acquired on the plane, which is why we want to speak to the other passengers on the plane, maybe another case there that again is known or not known to either ourselves or New South Wales. So the matching is going on as we always do with sequencing against the entire Australian database. We'll see whether we can get a closer match, as the Premier's explained very well. In fact, there's a number of different. Not every single genomic sequencing gives us as much information as we'd like to. All the 38 cases we have now on the board will all be sequenced. More information will come in over the coming days. And the epidemiologists and the contact tracers are doing all they can to find every possible link. And we'll work our way through that. We always do.
You mentioned Hobson's Bay cases that might actually be in the first cases in that cluster that weren't the Al-Taqwa teacher. What do we know about those cases? So
we know that the first two cases we reported in Hobson's Bay a couple of days ago. So there was another set of family relatives in a different household, also in the Hobson's Bay area. There's a number of positive cases in that household. Some of those infections may be earlier, maybe older infections than the Hobson's Bay couple we've started with. That's all part of the work we're unpacking at the moment.
So how many households?
So there's two households in Hobson's Bay.
Including the teacher?
Correct.
And so the potential earliest ones were the relatives of the football player?
That's right. Yeah.
But there's a chance there could have been multiple household visits going on through that whole period. If they were earlier, then
let's not get too drawn down the plug hole on that. We have seen across the 38 cases we're looking at, we have seen some pattern of household-to-household contact and communication. Some of that has led to transmission of the virus. I'm not going to give a running commentary on which household at what time. We have seen this in this outbreak. We have seen that in previous outbreaks. As we've said so many times from this lectern and others, that is a behaviour that we just need to stop doing at this point in time. We cannot allow the virus to spread through our closest and most intimate contacts. That is why we have the lockdowns in place. That's why the household restrictions are in place. Nick?
Just a point of clarity. You may already have said this, and pardon me if I missed it. The people in the public housing in Flemington, which are they connected to, Maribyrnong or Hobson's Bay?
Hobson's Bay.
And what is their connection with Hobson's?
So it's a single household of 8 people. There is a connection. One of them is a student at Al-Taqwa College. That's a connection that we have.
And also, we've had a number of reports of security guards, traffic controllers at testing not wearing masks or any form of PPE. Now, how would you react to that, and should there be a clampdown on that?
Well, I would be very disappointed if that was the case, Nick. I mean, given all the experience we've had and given the exceptionally high standards we see at our testing stations, I'd be exceptionally disappointed if we have evidence of staff in those setups, whether they're traffic controllers, contractors, whatever, not doing the right thing.
Victorian, do we know what percentage of people in public housing towers have been vaccinated?
So we've had an in-reach vaccination program that public housing towers that's been running for about 5 months now. Around 30% of people within the public housing estates have currently been vaccinated with at least the first dose. That program continues to run on.
We just need to be just crystal clear in relation to this public housing tower. The positive cases are not there. They have moved out, and we're very grateful to them. Sometimes there's a bit of hesitancy to move out on the basis that having secured a public housing place, there can be some hesitancy about that. But pleasingly, this family has moved out. They're not in the towers. Their presence is no longer an infection control risk. So we are supporting all those other residents. But they may have come in contact. They may have become infected because of their proximity to that family. They're Tier 1. The rest of the place is Tier 2. That status can change, though, based on positive and negative tests. So it's being treated no different to any of the other very successful apartment block. I say successful, I'm not for a moment pretending it was easy for the people who are in there, but We have locked down and had a public health response for a number of apartment blocks in recent times, and they've all worked very well to limit the spread.
So we're not where we are last year?
No, in many respects, every outbreak's unique, every case is unique. There'll be some similarities. Obviously, it's the same virus to a certain extent, but Delta means it's a very different challenge.
Isn't this an acknowledgement that you could have had a more nuanced approach last year that wasn't as drastic and didn't infringe on human rights as the Ombudsman said it did?
No, we've responded to the Ombudsman's report, and I won't go back over that again today. That intervention saved lives, and whether the Ombudsman agrees with me or not, I'm not too fussed. That saved lives.
This response will also save lives.
It
but
will.
It doesn't keep people at home with an hour's notice without being able to get food.
Well, and every outbreak is different. Every case is different. You learn, you improve, you do things differently. But I'm not for a moment accepting of a commentary, and that's what it is, after the fact commentary, that calls into question that response saved lives. It absolutely did. Absolutely. Now, again, we're grateful to you. I know it's a bit targeted, but if you can make a feature of your coverage, and I'll be deeply grateful to you, that the notion of those payments, $450 to get tested while you wait for your result, and $1,500 if you've got to isolate for the fortnight. The more we can get that information out, hopefully the more people will make the very best decision that's in our collective interests, rather than that terrible choice of having to maybe go to work when they've got symptoms and they're a bit iffy on whether they should test. Just a common sense thing. I'd be deeply grateful to you. And of course, those other messages remain the same. If there's one thing you take out of today's numbers, get tested as soon as you have any symptoms. That's the biggest and most important thing we can all do. Any other issues?
Where can they apply for those payments?
Just go to the website, coronavirus.vic.gov.au, the usual, and you'll be able to find it. If you are interested in taking me up on my request to publish it widely, I'll get you, if there's a link you might be able to push people towards. We've had thousands of people go through that program, but there may well need to be thousands more.
Yeah, I couldn't find it. Maybe that's a reflection on me. Rather than...
Premier, just one last question. It might seem obvious and it is premature, but essentially if you've got plans next weekend or maybe the weekend after or the weekend after that, should you probably start thinking about cancelling?
No, I think it's too early to do that. What I would say to you is every day is a challenge with this, and none of us can have a day off from it. We've all got to keep working hard to make good choices for our family and every family. And if we keep doing that, then we will see, yes, more cases. That's the system working. But hopefully over time we can see less and less of them out in the community during their infectious period. And that's when we have all sorts of options. This won't last any longer than it needs to. And it's only been put on because there's simply no other choice. If we had other choices, of course we would use them. Of course we would. That's not the luxury that's available to us yet, unless and until 80% of us, and hopefully more, go and get not one but 2 jabs of the vaccine that their doctor believes is the best for them. Thanks very much, everyone.